Threat of the Delta variant is significant. The presence of the Delta variant now 4 times higher than it was in April. Health officials saying it could result in higher than expected number of infections in the fall. We have Dr. Ronald St. joining us, the former Director General at the Center for Emergency Preparedness and Response, to talk a little bit more about this. And I know you were listening in as well. So yes, the numbers are good. Vaccination rates on their way up. But, a little more information and concern about the Delta variant, how quickly it's spreading, and the worry that it could result in the rise in numbers in the fall. I wanted to get your thoughts on that.
Thank you. Good afternoon. Yes, I think we're in a race. Yeah, if you want to look at it that way. The Delta virus is more easily transmitted. It is going to spread. I think it will become the dominant virus in Canada, just as it has in other countries. I think it will pose a risk, certainly for unvaccinated people. It will perhaps be somewhat of a risk to partially vaccinated people, where there is less resistance to that particular strain. So hopefully we can get more and more people vaccinated, double dose, fully vaccinated as fast as we can, and try to keep ahead of this virus. But I think it will be here.
Could it be much more prevalent than we are aware of right now? And I ask that because of the sequencing, and I think the statistic out there is 18%, but they want to get to be able to sequence 100%. So if the sequencing is only at 18%, but we're seeing this rise in numbers, what don't we know?
Yeah, it's possible. Certainly possible that it is spread more widely than we know at present. That's a matter of searching and finding out where this virus is, and that requires the genomic testing, and it's a complicated issue. How do you know where the virus is? New cases need to be carefully tested to find out exactly what virus has infected them, so that we can at least get some tracking of the virus through testing new cases of COVID. But you're right, there's probably more out there than we know at the present time.
And they also, Dr. Tam, specifically mentioned the UK, essentially saying we've got to look to see what has happened in other countries. And the UK had to push back its reopening plans by 4 weeks, specifically because of the Delta variant. What can we learn about that? And what was it suggesting? Because it was almost as though we may have to do the same thing.
Well, time will tell. We may have to. It's a lesson, but don't forget the UK is not Canada. The population is much denser there than it is here in Canada. The spread of the virus would be much more easily done in a dense population. So we may not get the same rate of growth of the Delta virus in Canada. Time will tell. There may be areas of the country where we will have to reverse our loosening up of our public health measures and go back to stricter lockdown. There are some lessons to be learned in Australia at the present time, where after periods of no cases at all, they've had sudden outbreaks and have had to lock down the city of Melbourne, for example, for a period of a couple of weeks. So we may face this situation of outbreaks, limited outbreaks, have to respond quickly, some lockdown procedures, time limited, but to get control of the situation. I think it's doable, but people have to understand that we may have to go back to some more serious measures temporarily to get control over a local situation.
Okay. Dr. Ronald St. John, as always, thank you very kindly for your time.